Healthcare is the #1 issue on the minds of Canadians. It's consistently ranked as the #1 issue. Yet it's important to recognize why healthcare is the #1 issue. In large part, it's because all Canadians have personal experience with the system, whether directly or through families or their communities. It's through this personal and specific lens that people view the healthcare system. It's one of the reasons that there is such a reaction when any attempt is made to restructure healthcare, to reform it. And that's in fact one of the reasons why so few politicians are willing to make moves to restructure healthcare. I use the example of Ontario in the 1990s, where it's widely perceived and by most people that Mike Harris cut healthcare. In fact, he increased healthcare spending year after year after year by billions and billions of dollars. Challenge is that as he was increasing healthcare spending, he was also restructuring hospitals. So 15 years later, people remember the hospital restructuring. They forget the fact that healthcare spending has increased. It's just one example of the difficulty that politicians have in reforming healthcare system. That's why it's not surprising that in the recent federal election, all parties talked about increasing federal health transfers, or continuing to increase them by 6% a year. They were making these promises at a time when federal revenues were in decline during the recent recession. It's so strong is the multi-partisan desire not to get on the wrong side of public opinion that there's this consensus to keep spending. In fact, as I said, the one promise you can count on any politician, any party to keep is to increase healthcare spending, because they've been doing that for at least the last 25 years, and there's little expectation or chance that that'll change.